Hello, everybody. Welcome to the COVID-19 coronavirus disease 2019/2020 uh, disease. Got questions? You can contact us at funtime_channel_health_minute coronavirus/COVID-19 pandemic so you can get any information on anything we talk about today. There is currently 2.93 million confirmed cases in the United States of America, 879,000 recovered, and 132,000 deaths, adding 212 deaths to that number. We are adding 43,003 thousand cases to the United States number. Worldwide, there is 11.5 million cases, adding 203,000. 6.21 million people have recovered, and 535 deaths, adding 5,193 deaths to that number. Currently in Florida, there is 206,000 cases, adding 10,059 cases to that number. There is currently 29 extra deaths in Florida, making that to 3,778. In Texas, there is 195,000 confirmed cases, 3,449 are being added, and 29 deaths to the number of 2,637. In Arkansas, there is currently a total of 23,814 cases and 287 deaths. Cases in the last 7 days are 4,504. New York, 180,162 cases and 8,705 deaths. In Texas, we already discussed the case numbers, but they are hitting that level for capacity on ICU beds and hospital capacity. If you feel like you have something else besides COVID-19, please try to stay home, because those people that are in that hospital for COVID-19, it's going to overwhelm the hospital. COVID-19 patients do need that space, and I know for a fact that other people may need that space too, but COVID-19 is an ongoing pandemic that we need to really focus on. Now, if it's cancer and somebody's dying, I understand all of that, but please try to stay home. Hope everybody had a good 4th of July. Florida surpassed 200,000 coronavirus cases Sunday, while the FDA commissioner declined to support President Donald Trump's views on the pandemic, and the mayor of Phoenix in Arizona reported too soon. Arizona reopened too soon, feeling a boom in new cases among young people. We reemerged at 0 to 60, Phoenix Mayor Kate Gallo said Sunday. Our 20 to 44-year-olds, which is my own demographic, really led the explosion. Trump hosted a salute to America on Saturday in Washington that included a massive fireworks display in National Mall in Washington. Trump assured the crowd that 99% COVID-19 therapies were harmless and that a vaccine or therapy would be developed well before the end of the year. A rally for New Hampshire will be July 11th, which was announced Sunday. Let me tell you that yes, a vaccine may come out before the end of the year, but it's more likely to be in the first quarter or second quarter of 2021. Food and Drug Administration, speaking Sunday on CNN's State of the Union, was asked about Trump's assertions. Hahn declined to answer, saying data shows the virus is a serious problem and that science will determine when vaccines or therapies are ready. Hahn also said it is too soon to determine whether the Republican National Convention can be safely held in Florida next month amid the surge of COVID-19 cases there. Recent developments: Broadway and Nick Corder was hospitalized for more than 90 days after contracting the coronavirus and died Sunday. He was 41 years old. The World Health Organization said member states reported more than 212,000 new confirmed COVID cases Saturday, the highest single day since the start of the pandemic. Cases in Texas and Florida to hit records high again on Saturday. The Texas Department of State Health Services reported 8,076 new COVID-19 cases Saturday, marking the first time Texas crossed the 8,000 threshold for new cases in a single day. And Florida reported 11,458 new cases of the coronavirus Saturday. Also a record for most new cases in one day. Today set the U.S. record 45,283 new cases of coronavirus Saturday, snapping a streak of multiple days for more than 50,000, according to a tally kept by Johns Hopkins University. The daily death toll was 242. It was not immediately clear what impact the holiday had on collecting the totals. The U.S. has seen more than 2.8 million cases and more than 129,000 deaths. Globally, there have been more than 11.3 million cases and more than 532,000 deaths. President to hold rally in New Hampshire July 11th. He is scheduled to hold an outdoor rally Saturday in Portsmouth, New Hampshire. The coronavirus pandemic, the rally will be held in Portsmouth International Airport just 3 weeks after the rally in Tulsa, Oklahoma. There has been a surge in cases, and some scientists are considering COVID-19 may be airborne. The WHO, World Health Organization, has had no evidence of it actually passing through the air, but some evidence shows otherwise. The WHO, World Health Organization, will give a confirmation on that coming soon, sometime this week. And it is led to believe that some Republican governors are going back on what they said at the beginning of the pandemic. 240 scientists say coronavirus can be spread through the air and people need to know. With this being said, it is recommended you wear a face mask even when you're socially distanced because it can spread in the air. But not saying that it is, but from what's being said, scientists are urging people to wear face masks even if you're walking outside. There's a group of 240 scientists. It's urging
now Simparica
health
Trio simplifies
care
protection.
agencies,
See ya.
agencies and government officials to pay more attention to the potential airborne transmission of the new coronavirus. There is significant potential for inhalation exposure to the virus in microscopic respiratory droplets, microdroplets, at short, medium distances up to several meters or room scale. And we are advocating for the use of protective measures to mitigate the route of airborne transmission. The group said in an open letter published Monday in a journal, clinical infectious disease. The letter said most public health agencies, including the World Health Organizations, do not recognize airborne transmission of the virus that causes COVID-19. Procedures are being performed to get evidence in healthcare settings. In an update on the coronavirus on June 29th, the WHO said airborne transmission of the virus is possible only after medical procedures such as intubation and CPR that produce tiny aerosol droplets smaller than microns. Dr. Benedetta Elganazai, the WHO's technical lead on infection control, told the New York Times that evidence of the virus spreading was unconvincing. Especially in the last couple of months, we have stating several times that we consider airborne transmission as possible, but certainly not supported by solid or even clear evidence, she said. There is a strong debate on this. WHO guidance says the coronavirus is transmitted primarily between people through larger respiratory droplets and contact and maintaining distance. And sanitizing hands and surfaces are the way to stop infections. More experts are beginning to disagree and say there are more hand washing that needs to happen to prevent the virus from spreading. Hand washing and social distancing are appropriate, but in our view, insignificant to provide protection from virus-carrying respiratory microdroplets released into the air by infected people. This problem is especially acute in indoor enclosed environments, particularly those are in crowds and have adequate ventilation. Donald Milton, a leader of the group and professor of environmental health at the University of Maryland, said the health agencies don't want to talk about airborne transmission because that is going to make people afraid. He said there is a growing concern people will stop doing other things they need to prevent transmission, such as washing hands, staying apart, and cleaning surfaces, if they think the virus is airborne. Lindsay Marr, an expert in airborne transmission of viruses at Virginia Tech, and one of the scientists who signed the letter, said the coronavirus seemed to be most infectious when people were prolonged contact at close range, especially indoors, the New York Times reported. Paul Hunter, professor at medicine at the University of East Anglia and the member of the WHO's Infection Prevention Committee, said the WHO has struck the right to balance in its advice. Transmission can occur, but it probably isn't that important to gain some scheme of things. It's all about droplets. Controlling airborne transmission isn't going to do much to control the spread of COVID-19. It's going to impose unnecessary burdens, particularly in the countries where they don't have big enough trained staff or resources already. I am very much concerned about the general public and schools and ventilation in school buildings, in dorms on college campuses, and in bars and in churches where people sing and where people congregate. Some measures to those groups are being recommended in the letter. Provide significant and effective ventilation. Supply clean outdoor air. Minimize recirculating air, particularly in public buildings, workplaces, environments, schools, hospitals, and nursing homes. Supplement general ventilation with airborne infection can such a local exhaust, high efficiency air filtration, and germicidal ultraviolet lights. Avoid overcrowding, particularly in public transportation and public buildings such as the workplace, nursing homes, schools, churches, and events. We hope that our statement will raise awareness that airborne transmission of COVID-19 is a real risk and that control measures as outlined above must be to the other precautions taken to reduce the severity of the pandemic and save lives, the letter said. Cases in the United States have surged as many states have reopened, many states in phase 2, barely any in phase 1, being Missouri the only state in phase 3. Many states have reopened their economies and people began gathering in bars, restaurants, and other venues. Nationally, there have been 22.9 million confirmed cases according to the data complied by Johns Hopkins University. There have been more than 130,000 deaths in the U.S. Trump claims 99% of the U.S. COVID-19 cases are totally harmless. Trump has celebrated Independence Day with a string of false and misleading claims attempting to play down the coronavirus pandemic and warning that China will be held accountable. The U.S. president staged a salute to America in January on the south lawn of the White House with flyovers by military jets, parachute jumps, and patriotic songs. But little effort among guests to physical distance or wear face masks. Republican governors have went back on what they have said at the beginning of the pandemic about face masks. Face masks should have been worn there, as said by Governor Asa Hutchinson of Arkansas. Social distancing should have been done there. The country has undergone staggering changes unthinkable when Trump hosted the first ever such event a year ago on 4th July with tanks and other military hardware at the Lincoln Memorial. The coronavirus has infected 2.8 million Americans and killed nearly 130,000, the world's worst tallies in the world. Saturday's national celebration was infinitely more subdued, but the president refused to let the pandemic or dismal poll figures rain on his parade, waving his wife Melania from a White House balcony. When walking to the south of lawn to ripples of applause and a cry of 4 more years. We got hit by the virus that came from China, the president said, prompting a strange whoop and applause from someone in the audience. We've made a lot of progress. Our strategy is moving along well. It is going out in one area, it rears back its ugly face in another area. But we've learned a lot. We've learned how to put out the flame. The number of infections now regularly top 50,000 per day, higher than April when the U.S. was in the first grip of infections. Dr. Anthony Fauci, the nation's top infectious disease expert, warned this week, I think it's pretty obvious that we are not going in the right direction. Trump returned to that statement saying the U.S. is going in the right direction. Dr. Anthony Fauci saying back, warning us if we don't take the appropriate actions now, the U.S. will not have a lot of people left after this pandemic. Trump returned to his now familiar and baseless complaint that America has a caseload because it performs more tests. Now we have tested almost 40 million people. By doing so, we show cases 99% of which are totally harmless. Remember, asymptomatic people can spread the COVID-19. Results that no other country can show because no other country has testing that we have, not in terms of numbers or in terms of quality. It was unclear how the president arrived at 99% harmless figure. He also returned to his criticisms of source of coronavirus. China's deceptions and cover-up allowed it to spread all over the world. 189 countries and China must be held fully accountable. There was applause from the guests, but the White House has so far failed to detail what measures are being considering against Beijing, with which is recently struck a major trade deal and contradicting Fauci and other public health experts. The Trump offered a wildly optimistic prediction will likely have a therapeutic and or vaccine solution long before the end of the year. The presidential election is on November 3rd, 2020. But the lion's share of Trump's remarks were rehashing of a speech he gave on Friday at Mount Rushmore, breaking from 4th of July tradition and seeking to stoke a culture war and pour salt on America's racial wounds instead of unifying messages. We are now in the process of defeating the radical left, the matrix, the anarchists, the aggregators, the looters, people who in many instances have absolutely no clue what they are doing, he said. A vaccine is likely to happen before the end of 2020, yes. It won't be able to be distributed until the first or second quarter of 2020. Trump went on, in every age there have been those who lie about the past in order to gain power in the present. Their goal in demolition, our goal is to not to destroy the greatest structure on earth, what we have built, the United States of America. The U.S. is not heading in the correct direction, Dr. Anthony Fauci says, and the U.S. is in deep trouble. I hope everybody listened to this COVID-19 update over what happened over the holiday weekend and over what happened today as the first day back into regularness from the 4th of July Independence Day holiday. I hope everybody does wear a mask, and if you got questions over anything that was said for this COVID-19 update, please contact at funtime_channel_health_minute. We have the latest COVID-19 news and updates. We'll see you guys back here tomorrow for